All right. Good evening, everybody. I'm Dr. Deanna Minich, and welcome to this evening's version of the Personalized Lifestyle Pearls. I think we're going to have fun tonight. I always enjoy talking with Dr. Robert Silverman. Whenever I see him at conferences, I don't know, there's just something about him that makes me laugh, and I feel like his depth of knowledge, it just goes very deep, and he's expert on a number of different things. So welcome, Rob. Glad to have you here with me to have this discussion.
Absolutely happy to be here, Deanna. It's going to be a pleasure, and you're right. We're going to have a lot of fun.
We are, and especially I think that today's topic is one that just keeps coming up over and over again. Everything keto. And you've written some blogs on the ketogenic diet. I've had some time and opportunity to read those blogs. They were excellent. So one of the things I want you to clarify for us is to talk a little bit about what is dirty versus clean keto. What is that about exactly?
Absolutely. You know, that term has been used so much in the mainstream, many different blogs. So we all know what keto is: 75% fat, 20% protein, 5% carbohydrates, underneath 50 grams of carbs, get them into ketosis by day 3. But clean versus dirty. So there's so many people out there that say 75% fat. They're eating trans fats. They're eating processed foods. They're not picking the foods from the rainbow, which is so intrinsic to somebody like you. Absolutely. So we want clean food. So we want, if they're going to pick fish, we want wild fish, picking it from the smash fish, salmon, mackerel, anchovies, sardines, and herring. We want non-processed meats. We want grass-fed beef. We don't want the, soy and corn-fed beef. So they're picking poor fats. Again, those trans fats. So eating cleaner foods is going to lead you and give you a better outcome. Some of the reasons that they found that ketogenic doesn't work is the poor food choices within those dirty ketos. So that's one of the biggest things that I can say. And I know I'm going to start it here and we're going to go for it. For me, the clean keto is no butter, but you can always have ghee and clarified butter, because I'm no dairy and keto. Oh no, here we go.
Well, before we get into dairy, outline for us, in your perfect world, what a daily menu would look like in a clean keto, Dr. Silverman style, the ultimate way to do this. Just kind of quickly outline how that might look from breakfast to dinner.
I love it. So we're meeting for breakfast. We're going to be at the conference and we're going to have some eggs. We can have anywhere between 3 egg whites and 1 yolk to 3 eggs total. We're going to have some avocado. We're going to drizzle a little olive oil on it. And if you want to go wild, you can have some nuts or a small amount of blueberries. Our snack, if you want to have a snack, we're going to have some nuts and things of that nature. Our lunch is going to be great. We're going to have a wild salmon. We're going to have wild salmon with greens. We're going to have some more avocado. And again, we're going to have some more nuts. You're going to love our snack because we're going to get 90% dark organic chocolate. Fully yummy. And dinner is going to be a full salad. We can put a little bit of carbohydrates with it. We're going to bunk up on some coconut. We're going to bunk up on some either grass-fed beef or natural organic chicken. You can have a mix of the white and the dark meat, and you have just consumed everything you need. If you need more calories and fat, we're going to substitute with some MCT oil, medium chain triglycerides. So that's my best option for a quick ketogenic day.
Now, Rob, you know that I'm into eating the rainbow, and I was just writing down all the foods that you mentioned.
I think I lost it.
The only color we're missing is red. What would be a red food that's acceptable on keto, a plant-based food? Fantastic. Yeah. So let me just do a quick recap here of what Dr. Silverman was saying. He was saying for breakfast, and this is clean keto versus dirty keto. And what is clean keto? It's where we choose healthy, good quality fats. And keep in mind that a lot of the fats that are in, oh, there he is. Let's get him up here. A lot of the fats that are in our foods might also be contaminated with a lot of these lipophilic toxins. So we need to be aware. Are you back? Can you hear me?
I'm back. I could hear you. I heard you on delay on the, sorry about that. I don't know what happened. That's never happened.
I know. Okay, good. So Jessica, I was asking you about some red foods, and the audience is actually chiming in. So
that's great. I need help.
We've got
multitude of ways.
tomato, raspberries, strawberries, red onion. Awesome, Jessica. Small amounts of beet if you're training a lot because of the nitrates to open up the vasculature. So that's great. Wonderful menu here. Now you left out dairy. Talk with us more about why. Now, one of the things that you mentioned in our PLP preview was that before people come to see you, you want them off of gluten and dairy before they even get started with you. Talk a little bit about why that is.
Well, I'm a big proponent in my GPS. No gluten, no processed food, no sugar, no dairy, no nicotine, no artificial sweeteners. So gluten and dairy are big because I believe everything functions better when you have good quality gut health. And two of the biggest culprits, we've talked about this a multitude of times, is the consumption of gluten and dairy, maybe even dairy more so than gluten. So I take the dairy out. So the only real thing, because we could have clarified butter and ghee, the thing that they lose, that their heart breaks a little bit on, is the cheese. So I get it. There's no, we're just getting, and we talked about it, some vegan cheeses that are starting to taste pretty good. The gluten is not a problem. So I'm big, if there's a break in the system, the diet doesn't work. So I'm a big believer in keeping the breaks. I'm always detecting for barriers and any kind of repair that we have to do. So no gluten and no dairy. If they can do that, they can do any diet that we put them on.
So you just said ghee. Why do you allow ghee, which is clarified butter, versus no butter at all? Like that hasn't been clarified. Why is that?
That's such a good question, because my understanding of clarified butter and ghee is that the dairy particles are burned away, so it doesn't get processed in the body as dairy.
I'd like to see more science on that, because I have been monitoring the literature on ghee. Mm-hmm. It seems like ghee can upregulate some of the detoxification enzymes. Ashley, since you're on, if you want to do a quick PubMed search on ghee, because there's some interesting emerging work on it. I think we need more. It's been used in Ayurvedic medicine for years and years. So I would just wanted to see your take on it. So that's very interesting.
That's my take at this point. And we're evolving. I mean, this whole field is evolving. The ketogenic diet is evolving. Things may change from the time we end.
Sounds good. Okay. So if we're eating this way that you're describing, according to this clean keto way, do you anticipate that we would not have any vitamin or mineral deficiencies or insufficiencies?
Oh, every diet, unfortunately, seems to have certain vitamin deficiencies that resonate. So for the clean keto and keto in general, here's a couple of things that come to mind right away. Magnesium. Although most Americans are deficient in magnesium is going to be pretty deficient. So I'm going to always recommend a magnesium supplement, a bisglycinate, so we can get up to 400, 600, 800 milligrams without any gastrointestinal upset. Fiber. We're taking out a lot of carbohydrates, not having enough fiber. We got to make the people poop. So we'll probably have a fiber supplement. Some MCT oil, only because I restricted some dairy. So we're not getting that fat, or what some people may perceive as clean fat and fuel. So medium chain triglycerides. The medium chain triglycerides, we want an extract of coconut oil, not palm oil. That coconut oil should be carbon 8 and carbon 10 because it's great brain fuel, not carbon 12, which is lauric acid. It's a slow moving triglyceride, really healthy for us, lauric acid, one of the emphasis of why we want coconut oil. However, it's not quick, and I'm looking for quick energy, especially brain energy.
Mm-hmm. Good. All right. Let's go back to fiber. I'm kind of curious to pick your brain about fiber sources. For some people, they just think I'm going to take a supplemental fiber, and then they start taking psyllium. What's your take on fiber? What are your principles around fiber? How should we take it? Should we be getting it from food or from a supplement? Do you have certain kinds of fibers you like?
Sure. I like a mixture of soluble and insoluble. Very easy answer. I'm a big believer, at least 30 grams of fiber per day. Bottom line is, and we've talked about this before, food is the starting point. Everything starts with food. Hence the idea of supplements. If you can't get into food, right, or you're in a position that you need more, your body needs more, you're injured, you're deficient, hence the term supplement, supplemental to lifestyle changes. So I'm a big proponent in food. I do believe to eat from the food rainbow. I agree with you. I know you're a little more plant-based, so I'm a little more keto, but right in the middle, it's all about whole foods. By the way, a lot of great literature on plant-based diets. Absolutely a great option.
Yeah, in fact, Ashley has posted here a blog on a plant-centric ketogenic diet. So Rob, you and I can actually meet in the middle on that. I mean, I think that, I mean, what if you're a vegan or vegetarian and you want to do a keto approach? What do you do for those patients?
Yeah, you're right there. You're right in the plant-based. You're using a lot of the algae oils and things of that nature. So I agree with you. I'm not keto all the time. I don't keep all my patients on keto all the time. So that I know that'll be a segue into a few questions that you may have. And I do believe in the plant. I mix people around. So when I recommend the keto, I recommend the keto. It's great for weight loss. It has good literature on the weight loss. It is without question outstanding for any kind of neurodegenerative disease and concussion. So if someone walks in my office, I treat a lot of gut to brain and a lot of concussion. The first thing I do is like, hi, concussion, ketone salts, MCT, get them right in there. That MCT oil absolutely gives them a little brain energy, and the ketone salts gets them into ketosis in 15 minutes for 1 hour. So love it for neurodegenerative disease. The literature is quite robust on that. Alzheimer's is another disease that we found that the Mediterranean diet works really well for. And segueing back to keto, blood sugar dysregulation is also a great choice for the ketogenic diet. Length of time, I've been up to the keto 3 to 6 months. I know there's some literature that says all the time, but I do like to always switch people's diets, because if we're going to eat from the rainbow, we're going to have to get off the keto and get into some plant-based. And if we want that biodiversity in our gut from the different foods, we're going to have to switch what we eat. Therefore, I don't typically myself keep everybody on a keto for a full year. It's usually 3 to 6 months, switch them around.
Yeah, I like that idea too. Now, you've been touting MCT oil from coconut.
Yeah.
There is some debate in the functional medicine sphere about people that have the ApoE4 genotype and whether or not they should be doing so much coconut. So are there certain genotypes or certain predispositions that we should be thinking not to be doing keto? Well, you mentioned a list of different conditions, right? Neurodegeneration, Alzheimer's, dementia, concussion. Where should we exhibit caution with using a ketogenic approach?
The two spots that I've seen where you could exhibit caution is ApoE2. ApoE2 is immediate. I mean, if you have it, start yesterday on your Alzheimer's protocol, get to the Bretson protocol, get to all those different kind of protocols. Without question, small amount of people have that. APO3 is the majority of us, probably 70+% that do not have the marker for Alzheimer's. APOE4 is that allele, and that's where you may not want to use the ketogenic diet, speaking to some of the mixed literature that you talked about, where you may want to go with that plant-based. So 7 out of 10, keto really good. Concussion, without question, immediate and acute. Unfortunately, untreated concussions can lead down a path of susceptibility to Alzheimer's because it damages the blood-brain barrier.
Yeah, good point. I really like that. Now, one of the things that I've heard from people, and I've even experienced it myself, is when people transition to a ketogenic way of eating or even do intermittent fasting, that women experience differences relative to men. What kinds of differences have you seen clinically?
Well, I can tell you this, any man or the bulk of men I've had that have followed it have got the results that we talked about in advance. The women have not responded like that. There was a study that just came out. It was in mice, and it was interesting. The male mice responded just like the humans, fabulously. The female mice responded in such a way that their blood sugar raised. They gained weight. It was adverse to them. And so they theorized that, well, maybe estrogen was the problem. They took out the mice's ovaries, and guess what? Everything worked out after that. The ketogenic diet worked. So after reading that and trying to synthesize that into humans, empirical research showed me I did it with women. I detoxed. I did an estrogen detox before and during the ketogenic diet with women in a menstruating age, 10 to 50 or 15 to 50, whatever that may be. And they got the results that they were supposed to within the ketogenic diet. So it's the estrogen. And we could probably have 6 hours here talking about estrogen. Obviously, that's a hormone that's very intriguing, and no one's really pinned the tail on a donkey with that and what to do. Nevertheless, detox before and during with women on a ketogenic diet.
Interesting. How do you do an estrogen detox? What you just said. So you start premenopausal women on an estrogen detox before they were to start a keto plan. How do you do that? What are some of the steps that you take? Do you have them on a certain diet? Do you have them on certain supplemental products?
Yeah, I give them specific ingredients that enable them to emphasize the methylation pathway in phase 2 of detoxification. As you know, phase 2 has 6 specific pathways, 2 of which are estrogen. So we're using specific ingredients to stimulate or upregulate that pathway. Most people, I'm doing the unleveling between phase 1 and phase 2. So by upregulating phase 2, especially that last pathway, they're able to get rid of estrogen. Most people out there don't realize, I know the docs do, but we have to tell our patients, the liver detoxifies estrogen. Man, when I tell my female patients that, their eyes light up. So I know, you know that, I know that, and everybody watching that, but we have to reiterate that to our patients.
Yeah, we do. And, you know, detox is such a buzzword, and so many people are very dismissive of detoxification, even though it's been in the literature termed as pharmacokinetics. We look at cytochrome P450 enzymes. So one of the things that I think of when it comes to detoxifying estrogen is the cruciferous vegetables and how important those are for shifting the ratio of the different kinds of estrogen. So are you also a fan of cruciferous veggies?
I'm without question a fan of cruciferous vegetables. I think I know somebody who may have written a book on detox. You'll have to let them know who that was.
Good books out there on detox, that's for sure.
Well, I was referring to yours, but nevertheless, yeah, cruciferous vegetables, absolutely. And one of the ones that comes to mind is broccoli. And the take on broccoli is we got to either chew it or chop it. We can't cook it, because when we do, it kills the enzyme myronase and doesn't make this great compound called sulforaphane. Sulforaphane is great because it really is excellent for phase 2 of detoxification and stimulates the NRF2 antioxidant pathway, which incidentally is the only pathway that we know so far that it can only get stimulated by nutrients and not drugs.
Perfect. Wow, that's really good insight. So here's my takeaway. You correct me if I'm wrong on this. So for women who are cycling and they're not postmenopausal, it would be wise to be looking at methylation pathways with a practitioner, to be looking at estrogen detoxification before embarking upon a ketogenic approach. Because I know for me, and I'll just tell you what happened with me, when I started doing some rigorous fasting and eating more fat, I noticed that my cycles changed. So I wasn't cycling, but every 50 days instead of every 30 days. So it was kind of interesting what was happening. And I've heard that from other people as well. And so there can be a delay or some changes that can happen for women with hormones and just in general menstruation. So I think it's important to acknowledge that. Let's get into keto for athletes specifically. And it ties right into what we're talking about with men and women, because some women who start exercising very rigorously, they start having changes in menstruation as well. And then if they go and do keto, now we have this layered effect. So what are some guidelines for men and for women as it relates to a healthy, clean ketogenic diet for these athletes?
That was such a great point, because so many women, they get their body fat low when they're exercising a lot, have an opportunity or a disopportunity, if you will, to get amenorrhea, the loss of a menstrual cycle. You combine that with keto, loss of menstrual cycle, that amenorrhea can start their osteoporosis about 10 years earlier, really increase their incidence of stress fractures. So again, if you're going to do the keto in a woman, a power and or an endurance woman, really adhere to some of the things we just talked about, like the detox. What's most interesting with women, I like the keto in athletes, because what happens is fat is much more richer than carbohydrates as an energy source. It's 2.2 times more enriched in energy. In addition, if we can get them in a ketosis, it enables them to get 20 to 22% more ATP production, which is huge. And last, but certainly not least, ketosis makes ketone bodies, acetate, acetylacetate, and the gold medal winner, beta-hydroxybutyrate. Beta-hydroxybutyrate is not only a molecule, it's a signaling molecule. It's an uncoupling molecule that allows things to go in and out of the cell membrane easier. In addition, it's great for brain fuel. It increases what we call BDNF, brain-derived neurotrophic factors, which is our body's ability to make brain neurogenesis. And what really is exciting about BDNF is it down regulates the NLR3 pathway, which is your innate inflammasome, which toll-like receptors 2 and 4 in the gut stimulate, which allows the vagus nerve to stay stimulated. So what I'm trying to say is it's a great anti-inflammatory. It's great for the brain. It's an energy marker, BDNF, and ketone bodies are the positive to ketosis.
Awesome. That's really good information. So athletes, like what would be a protocol for them? We talked about just like a day in the life of and kind of a menu, but what about an athlete that's engaged in more aerobic activity? Is it different than if you're doing, whether it's anaerobic strength training, stretching, more mind-body activities? Do you kind of see the different activities segmented? And then how does keto play into each of those? Just roughly.
Such a great question. So we got our power athlete, 10 seconds or less. We have an endurance athlete. So what's interesting, if you're not in ketosis, you ever notice somebody in a triathlon or something, they always have to sip and drink. So all their blood pools in their stomach, decreases performance. Sometimes because they can't digest, they have to have a potty break in the middle of their athletic event, posing an issue. You don't even need to do that. You just need to sip water because we always need to hydrate, because if you're burning fat, you've got up to 40,000 calories stored. You can only store carbohydrates to about 2,000 calories. So a lot of people don't have to eat, and they find out during athletic events, they don't hit the wall or bonk. A lot of people famously come right to the end and they just stop. Whereas the people that are using fat as an energy source really are able to pass the finish line at almost the same rate as they started.
So that's a really good point. The only thing I think about with athletes is dehydration and an imbalance of electrolytes. And I know that from people on the ketogenic approach, they tend to fare a little bit, you know, they have to watch their electrolytes, right? So is the way around that in an athletic event just to make sure that we have enough minerals, that we do stay hydrated?
That water could be laced with branched chain amino acids, or just electrolytes like you're saying, and you don't need any fructose or any kind of caloric input there. So that works really well. Mm-hmm. And we have to talk about electrolytes with the infamous keto flu.
Let's do it. Let's do it now. It fits right in. And that's kind of what I was thinking is like the role of electrolytes for an athlete and for somebody following a ketogenic diet. So say more.
Well, basically the keto... You're doing a great job. I love this. The ketogenic flu is real simple. It's when the central nervous system says, I'm not burning carbohydrates. Wait a minute, where's my fat? And you just bonk. And let me tell you something. If you don't tell them about the flu, or somebody goes through a flu, you're going to make them an angry person. The best way to describe
tell us about the flu. Let's just kind of take two steps back. Just kind of explain that a little bit for all of our viewers.
Typically, when you're switching from carbohydrate consumption as energy to fat, usually about day 3, you get what you call the flu. The flu is what it says. It's maybe the worst feeling you've ever had. You have a headache, you have fatigue, you have body aches. It's awful. I had an MMA guy, and tough guy, you know, bleeding from the ears. He would come in, all sorts of tough. He called me up and he says, if you don't get me out of this flu, you and I are rolling on the ground in 10 minutes. So believe me, I told him what to do. I was imbued with enthusiasm to help him out. Nevertheless, the reason they get the flu, it's interesting, is that without carbohydrates, they have a swish. And that swish comes through and all their water comes out and takes out their electrolytes. So many people think it's just getting the ketone body in, but it's not. It's the salt in the ketone salts that are the critical elements. So you've got to replenish the electrolytes. You could even give them a little Himalayan salt, takes them right out of the flow.
Really?
Yeah, Himalayan salt.
Himalayan salt. And
I'm a big proponent of the ketone
compared to the ketone salts. Which one would be better then?
Say that again. I interrupted.
Yeah. So which one would be better, the ketone salts, because you've been mentioning those a few times, versus the Himalayan salt?
I prefer the ketone salts, but not everybody has them in front of them, so they can grab some Himalayan salt. It slows. The reason that you get that flu, like we talked about, is also what they call natriuresis. It's your body's way of spilling, you know, sodium and potassium and the like. So you really need the electrolytes, and that's where a lot of practitioners fail, and a lot of patients say, "I'm done. This sucks. I'm not doing this anymore. So if you let them know, you get them prepared on day 3. Since that issue that I had with that one patient, now I tell them, I prepare them with salts or Himalayan salts, and guess what? Everything's copacetic.
Excellent. Chan is saying here, wow, thanks for that salt tip. You know, let's just talk about minerals a little bit here, because I have this philosophy, and in general, from what I see with people, is that they're just too short on minerals in general. We're not even just talking potassium and sodium. We're talking, just like you were saying before, magnesium, calcium. I mean, all the minerals, whether it's the macro minerals, micro minerals, or the ultra trace. So I'm thinking, you know, sometimes from a diet perspective, it's hard to get that. So sometimes we might have to bring in a supplement, right?
Yeah, and again, you and I both know first thing in is food. Hence the idea of supplements. Yeah. Clearly, with the ketogenic diet, we're going to need to supplement, and supplement again with the minerals and the electrolytes, the fiber, and the such. And it's interesting. You brought up a great point. It's in my head about the MCT oil. So yes, there is some conversation about MCT oil, and some of the conversation is that a lot of coconut oil increases the release of LPS. Lipopolysaccharide. Lipopolysaccharide, which is holds your gram-negative bacteria on the inside of your intestinal tract, sort of like the ivy on the wall. When that's expressed, we think we have leaky gut, and it leads to systemic inflammation. So again, it goes back to what we talked about. You can't be on any one diet. We just saw a study yesterday, Business Insider this week just said you got to switch all the diets because you have to eat plants, fermented foods, nuts, seeds, fruits, and vegetables, but the critical element was to keep your gut and your gut microbiome in pristine condition.
Fascinating. Wow. Do you give your patients any other tips when they're just embarking upon a ketogenic program, whether they're an athlete or whether they're not an athlete? You know, are there certain things that maybe only you would know from your clinical experience? Maybe it ties into some of these vitamins and minerals. You're so good with knowing kind of like the nutrient effects in the body and how that exhibits through the skin and through the hair and all those kinds of things. Do we have to be looking for certain things when we first start to override that flu effect? Or can you give us any more tips that might just be top of mind from working with patients?
Absolutely. Here's my big tip. It's I mix the ketogenic diet with what people have called intermittent fasting, but we know that intermittent fasting is an incorrect term. Intermittent fasting essentially means they're not going to eat for a day or two. So let's define it right. It's time restrictive eating. So when we say 12 hours of a fast, 12 hours of eating, it's time restrictive eating, 16 and 8. So I'm a big proponent of 12 and 12. What we found out is that restrictive window of eating has a lot of health benefits, autophagy, and also can make ketone bodies on its own. When you mix it with the ketogenic diet, you have a very synergistic approach to health. And I'm kind of like doubling down on all the benefits of the keto. I tell everybody I'm a chiropractor. Chiropractors C for cheat. I will do anything I can to get outcomes for you. And one of the things I do is cheat is I mix a lot of things with time restrictive eating.
Huh. So you do 12 hours of eating and 12 hours of fasting. That's what you recommend to your patients?
12 and 12 for somebody like you and me. 16 and 8 if they have the allele of APOE4 or signs of neurodegenerative disease. They've got to close the window a little bit more.
8 hours of time restricted eating and then 16 hours fast.
16 hour, yes, 16 hour of fast, 8 hours of eating. Somebody like us who don't have the alleles, 12 and 12.
Yeah. Okay. I like that. And so if you just did the ketogenic diet on its own, you won't have that same effect. It really does need to be coupled. But I'm thinking that it gets back to what you were saying before about pulsing the ketogenic diet and pulsing time-restricted feeding. You can't do this all the time. And so, like you said, a 3 to 6 month window, and then to kind of move and transition away from that. Is there a good way to transition away from ketogenic ways of eating and also time-restricted feeding?
That is the number one question that practitioners ask about the transition, because they say, wait a minute, so here I am burning fat, and I immediately go to, all right, say a plant-based, which is fat, but carbohydrates. How do I transition? What do I do so I don't have a precipitous drop and the patient gets fatigued and just hits the bottom of the ocean, if you will? So what I do is I start incrementally decreasing the percentage. So if I'm at 75% fat, the next week is 60. The week after is 50. And I start getting down till I can walk into the plant-based diet, which is, you know, for lack of a better term, 40, 40, 20, if you will. something of that nature. I know some people advocate 90 and 10 combined energy. I try and keep the protein a little higher. But what I will say, to speak to, I know you're a plant-based one of the things you do is you love your plant-based. I'm a big believer in the alkalinity really helping the protein to enable the mTOR pathway and protein synthesis.
Yeah, because protein has its own downside, right? Depending on where we're getting our protein from, all those amines. Mm-hmm. And plants can buffer some of those effects. So I think that's good. So I like that. So let me just summarize for everybody listening in. So you're talking about tapering. You're saying in a ketogenic diet, 75% of the calories coming from fat, but then as you ease away from that, you start to reduce that percentage to 60 to 50, and eventually to around 40 is what I'm hearing.
Right? Exactly. I went like that because each practitioner is something different, and we really should throw this out with all the functional medicine, functional nutrition practitioners out there. It's all about the individualization. That article that I referred in Business Insider, which is Business Insider, it really spoke to the idea of you may eat something and I may eat something, and it's going to react differently in both of us.
Exactly. And that's where we really need to be with nutrition these days, right? It's no more just general guidelines. It's about a personalized, individualized approach for you. All right. So our last question, I'm not seeing any questions here on our thread. So in our remaining minutes, if you have any questions, let's just get them out there. And if we don't answer your questions here live, we will get them post-show and try to follow up on them. Rob, one more question for you.
Go for it.
What about people with all this fat? Do you see any jump in lipids?
It's so funny. I would have to say that probably on the start of it, in the first few weeks, may not be the best time to take a cholesterol test because they may have the ingestion and not be burning everything. However, the literature is pretty stellar on the fact that the ketogenic diet, even though you're ingesting these saturated fats, has not been leading you down a path of heart attack and everything of that nature. So maybe in the first 4 weeks would not be the time that I would recommend you doing your yearly blood test, whatever it is. But after that, I think it's green light go.
Green light go. Okay, so keep tabs on lipids. I've seen that clinically, so that's why I'm asking you. And I know cardiologists have some concerns about their patients following a ketogenic approach. But one of the things that you're mentioning that I think is key is that people don't stay on this forever. Mm-hmm. Stay on this forever. Right? And so they're kind of transitioning. And so, we want to know about our ApoE4 allele and whether or not we've got copies of that. We want to know about lipids. I would think that we'd want to know, one last thing, I just have to bring this up because it really fits the profile of what to be looking for that perfect patient to be following keto. I see so many people with bile issues, right? So bile formation, liver toxicity issues. And so they're not producing enough bile to solubilize all this fat coming in. So what do you do to help people with that?
I think the lack of bile is one of the biggest reasons that we have gastrointestinal problems. I think it's one of the most overlooked things with practitioners. I think it's one of the reasons that we get SIBO, small intestinal bacterial overgrowth. Clearly speaking to the lack of bile with a ketogenic diet, maybe someone who's had their gallbladder removed, choose a different diet.
There you go. Another thing to be thinking about, right?
That would be a definite contraindication. And for me, in all my R's, whether it's 4, 5, 6, 7, 8, 9, wherever we are, I'm a big believer in getting the bile salts, bile acids to make bile salts, because that allows for the migrating motor complex in the small intestine to contract. It's those peristaltic contractions. I am with you 1,000%.
Okay, so you give something supplemental like taurine or some of the precursors to making those bile acids?
I do give all of those without question. I actually have a nutritional protocol to help the vagus nerve, which actually helps bile. And that's alpha-lipoic acid, fruits and greens, and some omega-3 fish oils.
Wonderful. Are you okay to stay on for 2 more quick questions?
As long as you want. I'm having a blast.
All right, me too. I love talking with you. I love your energy. Okay, Jessica is weighing in here saying, what would you suggest for a female athlete with amenorrhea on keto and has been keto for a few years already with amenorrhea from even before keto?
Well, obviously her body fat's low because she has amenorrhea. And the ketogenic diet as we talked about, can indicate an increase in amenorrhea. So my suggestion is, I know this sounds funny, but to get her off the ketogenic diet and get her on a different diet so she can start cycling a little more normally. I have an athlete here that hasn't seen her period, non-pregnant athlete, in a year. So you can't tell me that's normal. I'm not a female, so I don't get one, but I feel the pain in it. That just doesn't seem appropriate for me. So try and help her ease her off that. And by the way, for that amenorrhea, a lot of people I do, again, see a lot of athletes, detox, estrogen detox.
Estrogen, yeah. And I think too, to be looking at iron and some of the minerals, because some of those things can play a role in those different pathways as well. We do have a question from Dr. Mark K. Hi, Mark. He said, how do you feel about starting a patient with a program such as keto and then transitioning long-term to a Mediterranean-style eating plan? You've already mentioned this a little bit.
I love it. I think the Mediterranean diet has stood the test of time. It's actually a stellar diet. It's probably the easiest one of the easiest lifestyle programs we have. And as you get down, like we said, as the transition, you could go into the Mediterranean. Mediterranean, a lot of good literature on Alzheimer's, brain health, overall health. You can't beat it. It's one of the staple diets that we should consider.
Wonderful. And then finally, we have a general question about inflammation. So if somebody has inflammation in their bodies, would the ketogenic diet be something to be following to help reduce inflammation?
Well, yes, and I'll tell you why. And when one, we saw that beta hydroxybutyrate actually decreased inflammatory markers. Number two, probably the biggest marker that we're worrying about is insulin sensitivity and insulin resistance. And obviously, if you're not eating any carbohydrates, you're going to dim that particular insulin resistance and insulin sensitivity. So to ask that question, absolutely, especially if it's a clean keto and not a dirty keto.
Yay. Okay. Excellent. So just to summarize for everybody, what I'm getting here, we talked about a lot of different things. You gave us some tips, some excellent pearls on how to go clean with keto, how to bring in more plants with keto. You gave us a keto menu. You gave us some tips about certain minerals and certain things to be watching for, like fiber. You talked about butyrate. You talked about clarified butter. We talked about menstruation in women versus men with keto and athletes. We talked about ApoE4. There are a lot of things here. So thank you for sharing your wisdom. It's profound. And I think that this information will really be helpful to many of us who are thinking about doing keto or have been doing keto, who are very physically active. So thank you so much, Rob.
No, thank you. And just remember, as long as the fats are salubrious, you can consume them.
Okay. We will. And the variety of fats too, right?
Eat from the fat rainbow. How does that sound? Let's add that in.
I like that. I do like that a lot. So everybody continue to post your questions. I'm seeing some more questions come in here, but in the interest of time, we're going to have to sign off. We will revisit the thread. We'll come back and give you some more resources to explore. So thanks so much. Thanks for signing on. And, in July, we're going to have Dr. Carrie Jones on to talk about hormones. So it kind of dovetails very nicely into this discussion about keto and hormones, as well as men versus women. So we're going to continue the discussion. So thanks, everybody, for tuning in. Take care.